down the socialist ladder when we look to Europe for free market solutions. But that's what we're going to do right now. We're joined from Montreal by Frederik Roeder, who has a new paper on what Canada can learn from Germany's successful experiment in entrepreneurial healthcare. Hey, welcome to the show, Mr. Roeder.
Hello.
Now, over the last 2 decades, the percentage of healthcare in Germany that's done in the free market has more than doubled. Tell me what the results are. Are Germans getting better healthcare? Is it cheaper? Is there more patient time? What happens when we allow the free market into the system?
So, first of all, Germany has a universal health system as Canada. Every citizen is insured by the government. The difference between Germany and Canada is that Germany allows diversity in the hospital market. So citizens which are in the public health insurance can also go to private hospitals, get treated there, and the government pays the private hospitals for the treatment. The results are higher quality and no waiting lines at all.
So let me make sure I understand this. Everyone still has their bills paid by the government, but you've got different hospitals competing for those dollars. So the dollars travel with the patient, and if the patient chooses the state hospital or the private hospital, well, whichever one can win that patient wins the dough. Do I get that right?
That's absolutely right. Patients are free to choose out of more than 2,000 hospitals in Germany. So if you, as a hospital, if you want to attract patients and therefore generate revenues, you have to convince patients with high quality and a good reputation.
Now, it's a good point about high quality and a good reputation, because some would say, oh, if they're just going to be profit-driven hospitals, they might cut corners, they might be dirtier and things of that sort. Can you tell me, what does the research show? What are the facts? Are those private hospitals just as high-tech, just as clean, just as well-run as the government hospitals? I think I know the answer, but I wanted to hear it from you.
So actually, private hospitals have 10% less quality problems than public hospitals. And additionally, I would like to add that private hospitals invest about 40% more money per patient into new equipment.
Huh. Now, let me ask you, from your studies of Canada, do you think that we could move to this model fairly easily? I mean, we would still, I would imagine, have a government health insurance to cover people who fell through the cracks. How would it start? Just, I guess, an announcement that private companies could compete and they would submit their invoices? Like, it sounds like it's not a huge transition, because you're still having government insurance, you're still having patients covered. Is it easy to get from a state-run system like we have to one that has a modicum of competition like Germany?
Yes. I mean, the first thing which would have to be done is that the current system of giving hospitals ex-ante global budgets, changing this to a system where the money follows the patient.
Well, that's a great idea. Now, I suppose that would cause an accounting revolution, but that's not...
We have done that 10 years ago, and it's easy to manage.
Well, I suppose it's like the rest of the economy that has a customer-oriented system. Now, tell me, have the public sector hospitals pulled up their game? Have they tried to improve to win back customers who fled? For example, is the customer service more friendly? Do they have a more patient-centric or comfortable approach? I hate state-run hospitals. They feel like prisons to me. Have German public hospitals improved to win back some of that private sector competition?
Actually, yes. They became much more entrepreneurial. Nowadays, also the managers of government-owned hospitals are more managers than they used to be 20 years ago, when they were more like bureaucrats. Because if they don't offer at least similar service private hospitals offer, no one would go to the public hospitals anymore. So the whole sector, both public and private hospitals, became much more efficient and increased quality.
Well, that's great news.
Which saves money in the system and allows you to treat more and more patients. So the efficiency gains we just had within 3 years allow to treat 500,000 more patients with the same budget.
Amazing. Frederik Roeder, we're out of time. I'm so grateful for your breath of good news from Europe. That's a phrase we don't hear a lot these days. Your study was published by the Montreal Economic Institute. Folks can Google it and find it there. Take care, Mr. Roeder, and good luck. Thanks for the news.
Thank you very much.